Hi everyone, I'm Dr. Rita Roy, CEO of the National Spine Health Foundation. We're here to improve spinal health for everyone. It's an honor for me to bring this Spine Talks panel to you. Spine Talks provides unparalleled access to world-class experts like the doctors who are joining us today. Our panel will be moderated by Dr. Tom Schuler, Chairman of the Medical and Scientific Board. Tom will also introduce the panelists. Dr. Schuler?
Well, thank you, Rita. It's truly exciting to be here and to be with so many esteemed physicians. The National Spine Health Foundation works to bring you the information so you can help make the right decision, so that you can understand the best options for your care. And today, we're blessed to have 4 incredible surgeons join me who are part of the Medical and Scientific Board, the nation's top spine specialists who are here to help you understand your options. We have Dr. Shay Best from Colorado, Dr. Chris Shaffrey from Duke, Munish Gupta from Washington U, and Dr. Sig Bervin from out in California, UCSF. We are so excited. This meeting that we're at is one of the national meetings that we go to get the top information, the most recent information. And Dr. Shaffrey, if you can tell us a little bit about the meeting and why we're here.
So I'm Chris Shaffrey, as we mentioned, and I'm currently the president of the Scoliosis Research Society. The Scoliosis Research Society, about 25 years ago, decided that there needed to be a meeting where new technologies and new techniques could be freely discussed in their early stages. And one of the problems is, if we see a problem with a particular technique or technology, we want to know that very early on. So the Scoliosis Research Society, also called the SRS, formed a meeting called the International Meeting of Advanced Spine Technology, IMAST, and we were at the IMAST meeting. And this meeting focuses on what's new and hopefully better for our patient, but it's a meeting where there is an awful lot of discussion and debate to make sure what we're doing, which are perceived as advances, are truly benefiting the patients we're treating.
One of the things that I think is important to understand is how much the field of spinal healthcare has evolved over the past 3 decades. I mean, we're blessed to have physicians here that have over 16 to 30 years of experience in practical settings, out in practice, understanding what works. And to that point, Dr. Gupta, why don't we talk a little bit about what are the changes you've seen during your career?
Well, I can tell you I've been in this business for 30 years. I graduated in '92 for my fellowship from the Leatherman Spine Center in Louisville, Kentucky. And I remember starting with Harrington rods to Cottrell Dubuisset instrumentation, and then many, many segmental systems that I've seen. So Harrington instrumentation was the first instrumentation used for treating scoliosis patients. And actually it was designed in Texas by Dr. Harrington to treat polio patients, because when people got polio, their bodies got weak and they developed scoliosis. So he designed the Harrington system to kind of help the spine from curving. So it was revolutionary at the time, because before that, there was no fixation device inside the spine that could hold it up so it wouldn't develop severe scoliosis. But then it progressed to many other systems. And now we're in multiple generations of spinal systems. And it's been an exciting life for me to see from one hook on the top, one hook on the bottom with a rod in the middle, to many screws and rods and hooks being placed in the spine and being more efficient and being more effective in treating scoliosis.
So Sig, what is scoliosis and why are we talking about putting metal in people's back for it?
Yeah, really important question, an important problem in terms of our healthcare system. So scoliosis is a specific deformity of the spine that involves a curvature of the spine. So as you're looking at a patient straight on, there may be some curvature in the coronal plane or in the frontal plane, but it also is more complex than that. Spinal deformity broadly involves malalignment of the spine. So sometimes patients being bent forwards, sometimes off to the side. And spinal deformity is an important problem, both in the growing spine, and Munish alluded to that. Oftentimes this can be related to neuromuscular problems, polio, Most commonly, it's unknown. It's a developmental phenomenon where the spine may develop with some degree of malalignment. And in the pediatric population as well as the adult population, that can be a significant problem and result in significant pain, functional loss, and disability. And what's exciting about what's happened over the course of the time that you're talking about, the time frame, is our ability to safely and effectively realign the spine, improve quality of life, improve health status of patients has improved dramatically over our careers.
Yeah, and I think something called segmental fixation is the big change, kind of what you were alluding to. Shay, can you comment what segmental fixation means?
Yeah, and so what that involves is as Munish was saying, is that rather than having points of fixation above and below, you can actually latch onto the spine to pull the spine over. If you really look at, I think, what has emerged, especially in the past 15 years within spine, it's quantifying the disability and the pain and the suffering that these patients have, right? And I think some of the traditional teaching that we have surrounding scoliosis and spine deformity is that it did not actually cause disability, maybe a cosmesis problem, but the way that we are capturing data now and the manner by which we are able to assess our patients, both with x-rays or radiographically, right? But also from a clinical standpoint and using a thing called patient-reported outcome measures, we are then able to quantify the extent of their disability, but then also be able to assess what domains are most effective. And what do I mean by that? There are going to be some people that have self-image that's impacted, but there's going to be some people who aren't concerned as much about their self-image, but they have more of a pain or a physical function or a mental health portion of it. So in as much as advances have occurred, I think, in the implant side to help correct the deformity, right? The main advances in what we are focused on most granularly now is quantifying how much and what type of disability people have. If we have that, we can then counsel patients. And if we can counsel patients and then suss through what their problems are, we can probably come to the best treatment possible.
So what we're talking about is data collection, getting information, and it's not as simple as just saying, hey, are you better? Did you get better? But saying, how do we use scientific points to check function and understand? And that's really what we're going about. So Chris, do you want to comment on that at all? Data collection and how that impacts what we're doing?
Well, and again, that's it. I think most patients really don't want to disappoint their doctors, and they also have invested a lot into a different treatment, particularly for spine surgery. So if you make that decision, we like to find out truly how we're hopefully improving or altering people's lives. Learning about patient outcomes is important for us as physicians trying to do a better job, but it's also really helpful to go and to try to meet people's expectations. So as Shay had just mentioned, if someone is really upset about their appearance with scoliosis and you do something that may help their pain but does not give a cosmetic appearance, so they don't have a humping of the ribs or their shoulders out of alignment, you can oftentimes disappoint someone with their expected outcomes. So what we'd like to do is, as researchers, is to find better and better and safer ways to do it. And because many patients don't want to disappoint their physician or that they feel that they've invested so much, sometimes the amount of brutal honesty isn't always there. But by using some detailed questions, we can find out very accurately how a particular procedure or surgery impacts people's pain, function, their perception of their appearance, how that has helped them as far as mental health perspective, because if something's very disabling, it can be depressing or cause anxiety, and how all of those things change is really important for us to know.
But it's that data collection piece that Chris was just talking about, is in terms of why we are all sitting here and together in the room, right? Because we're at IMAST. And so what we're doing now at IMAST is taking those data collection pieces and then doing research on it. And then the question is, what do we do with that research? We then use those data to find the best treatments possible for patients, to reduce complications, and to really kind of sort through what patients want and what patients expect from different forms of treatment, which is very much what the SRS, the Scoliosis Research Society, is all about, namely providing research to inform surgeons as well as patients, and I think probably even a broader perspective, third-party payers. So I think it helps the society within spine care as a whole.
So really, we talk about the appearance, the cosmesis, so people are concerned about how they look when treating a spinal deformity, but then also the function. And those are the two big areas that we need to understand. So Munish, let's talk, go ahead.
So I think what Chris is talking about is that we're treating human beings. So we're treating human beings, not an X-ray. And that's critical because how the patient perceives their problems is very important to us because we want to do the right thing, right? We're not just looking at an X-ray, how straight we can make the curve. We have to look at their pain, where the pain generators are. We're looking at their perception of the cosmetic deformity. That is also very critical. I mean, I think that if a teenager comes to my office, she's not coming to look at the X-ray and how straight it is. She's looking at herself in the mirror and seeing what she looks like. So the patient's perception of the problem and their pain, all that is a very complex embodiment of their problem. So not just looking at the X-ray and making the spine straight or making it in good alignment is important. That's what Shay is talking about, is their perception. So if you ask a surgeon how they did, they will say, oh, I did great. Look at this X-ray, it's beautiful. But how does the patient perceive their outcome is super important. And I think that's a major advance in the last 15 years. And that's how we change our treatment protocols. That's how we improve what we do.
You want to follow up on that at all?
Well, yeah, I think being patient-centered in care is awfully important and fundamental to our role and our accountability as physicians who take care of disorders of the spine. I think an important concept is the appropriateness of care as well. And appropriateness has to do with a measure of the expected risks of care and the expected benefits of care. In terms of benefits, the expectations for improvement of alignment, appearance, improvement of function, improvement of pain, those are very reasonable expectations of our patients. And really being accountable for how reliably are we getting those outcomes is where these patient-reported outcomes come in. And also recognizing what the risks are is that anytime we're doing an invasive procedure on the spine, anytime we're trying to realign the spine, there are certain risks. There's risks of neurologic injury, there's risks of pain after surgery, there's risks of implant failure, and making sure that that ratio of risk to benefit expected is well balanced. And fundamentally, that's where patient-informed decision-making comes into play. It's having patients, parents understand what the expected risks are, what the expected benefits are, and deciding in an informed way whether or not surgery is appropriate.
So we have four of the giants in deformity surgery dealing with these structural problems of the spine, which are big problems because it's not just usually one segment. We know that there's 33 vertebrae that make up the spine, 23 discs, 50 facet joints, but we're talking about dealing with multiple levels, which is very different than the typical degenerative or just wear and tear problem. And so what is exciting to you today, Sig, about deformity surgery?
You know, what's changed a lot about deformity surgery, and I think what makes deformity surgery exciting right now is, number one, our ability to get effective corrections of the spine. I think we've got new technologies. Munish alluded to the evolution of techniques that we've got, from simple distraction of the spine to now segmental instrumentation. Our ability to get an effective realignment is better than ever. But what's really exciting is understanding what the goals of surgery ought to be. Understanding at each segment, at each region, what do we want to do with an alignment? How are we going to optimize that correction? How are we going to avoid future troubles down the line? That's something that's really exciting now, is being able to predict for the individual patient, applying precise principles to the individual, what's the right approach for that individual. That gives us a much more reliable approach to to improving quality of life and to reducing troubles down the line.
The big piece also, I think, really is understanding that we can make a difference. We can improve quality of life. And so the things that are exciting right now within probably the medical field, but especially within spine and especially within deformity surgery, which again is scoliosis or kyphosis, is that we have the ability to actually change not only how somebody looks, but also how they function, how they feel, and how they interact with their families and how they interact socially. And our ability to quantify that through research, and I think research is a tough concept for some people because you have to say, well, why are you doing this? And we're doing this to help understand our patients, but then also then figure out what then we can help the most for our patients. So while many of the innovations that happened previously, I think within spine, revolved around implants, which really became then the currency of spine care and surgery, the new currency really should be how do we improve outcomes? And then the research and how the government and how third-party payers see spine care in general will be under the lens then of how we're improving patients.
I'm so delighted to have all of you experts joining us today. We certainly live in a shared decision-making world where patients increasingly are expected to be participants in the decisions of their care and are frequently going to sources to try to find that information. At the Spine Health Foundation, we partner with organizations like the Scoliosis Research Society, where we're partnering with experts to help bring that information out to people, because it's really hard to understand. This is complicated information. The research it takes years to understand, and we want to make that understandable for patients so that you can then take that information to your doctor and have an informed conversation about what the treatment choices are for you. Because I think every surgeon on this panel would agree there is no cookie cutter approach to spinal care. It's different for every single person. Would you agree with that, Sig?
Rita, I think that's such an important goal. And again, why we're all participating in this program. Spinal disorders can have an incredible impact, perhaps more than any other common medical condition. Problems of the spine are impactful. And whether somebody's considering the minimally invasive type of a decompression procedure versus a major deformity reconstructions we're talking about, that decision is going to be a really important decision for patients. And I think empowering patients to participate in an informed choice is a really big goal of the program you're providing. We're happy to contribute to that.
I think it is critical to understand that spinal health care today, in this decade, in this time, is such a powerful, positive influence on people's health. And historically, everybody has said, well, hip surgery works. If you have a bad hip, get your hip replaced. If you have a bad knee, get your knee replaced. And nobody questions about whether that's a good idea. It's actually been proven through data, through research, that the outcomes from spinal surgery, simple spinal surgeries, not even the major deformity, but the simple spinal surgeries, that people gain better quality of life than they do from a hip replacement or a knee replacement. Which is kind of a shock to most people because they don't understand that spinal surgery works and is that powerful. And that's part of the message that we're here to convey. Dr. Shaffrey, one of the questions I have is, we talk about research, and I think the public sometimes thinks, oh my God, you're experimenting on me. Can you comment as to the research, what outcomes means, and what we're trying to do, and whether that's true experimentation?
So there are several different kinds of research, and some of the research is to evaluate the effectiveness of a new device. But most of the research that we here do is really we evaluate what we are currently doing, but we do it in a very detailed manner, and then we compare our results and see if there are lessons learned. So for example, there's a group called the International Spine Study Group. Shay is the head of that. And we just published a paper looking at almost 1,000 patients that were treated for spinal deformity in the ISSG. And there's also something called the European Spine Study Group, which does the same type of research that we do. So the patients operated on the ISSG and the European group were combined together. And what's happening is over a 10-year period of time, it was shown that we are doing things with 50% less complications than when we did it 10 years ago. The outcomes are about 60% better than what we did 10 years ago, despite us operating on people that are sicker and with worse deformities. And what happens is it's that kind of knowledge, and why the improvements is our group constantly is looking. And if somebody has a better mousetrap, if Shay has a better way to do it than I do, that's communicated. If Sig or Munish has something better than I'm doing, I learn from that and do it. And so the entire group, the rising tide rises it for all of these different groups. And I tell people when they come, sometimes there's people reluctant because we do a lot of detailed analysis now, including, for example, how functional or frail somebody is. So we have people do timed walking tests, and we use a dynamometer to see how strong they are, and we measure muscle mass, and we look at things like nutritional status to go and do it. And some of these things we're looking at, we've learned that if we improve a lot of things before surgery, if we make you more healthy and more fit before you have your major surgery, you're going to go through that surgery a lot easier, and you're going to end up having a better result coming out of the surgery. So these are the type of things we're doing. And so the majority of research, at least for the four of us, isn't looking at a new device. It is looking at what things that we can do to make you have a better result and a lower risk of having a problem at the end of the surgery.
So, I think the important take-home message for the public is that research is not experimentation. It's a way to say, how can we collect our data? Dr. Shay here is the master of big data. So how do we collect this data and then use it to better the patient experience and patient outcome, which is truly what we want to do. So part of it is technique, and you've talked about that, sharing the knowledge and technique. Dr. Gupta, can you comment about technology and what role that's played in getting us better results?
There's never been a better time to have adult spinal deformity surgery than today. If you look at the history, spinal deformity surgery today is safer, is more effective, has better outcomes than ever before.
Why?
Because we are screening our patients that are going to be better served with the deformity surgery, because these can be very difficult and large surgeries. So we can look at their bone density, we can make sure that that bone density is ideal, we can make sure we can do prehabilitation where they are actually more functional to recover from such surgery. And we have also substitutes for bone graft and all other technologies, reducing the blood loss in the operating room, making sure we have really good neuromonitoring when we're doing the surgery so it's safe. There's so many technological advancements that have made today better than any other time before to do adult spinal deformity surgery, and it's going to get more and more complicated as the population is aging. Okay, it doesn't mean that you're a little bit older, you can't have surgery. You can have surgery because it's now safer, more effective, and has better outcomes because of all the work that has been done technologically.
It's because we understand the pathology. We understand much more effectively what our patients need, what our patients are going through, why they're disabled, but then we also understand more what the more effective treatments look like, right? And so this allows us to sift through the things that are effective and not effective. It helps us understand, as Chris, Munish, and Sig were saying, our patient disabilities and how we can then truly impact them, right? And the real key to unlocking safety, the real key to unlocking, I think, having efficacious surgery or treatments is through understanding. We need to understand our patients, and we need to understand what we can do best for our patients.
So, Sig, we've talked about knowledge. We've talked about the supportive technology in the operating room, but I really also want to comment on the implants. And so two questions to you, and I know you got an answer you want to say already, but two questions is why are we putting metal into patients? And what are the advances that are helping us get the gains that we've just talked about?
Yeah, so why are we putting metal into patients? Why are we doing relatively invasive things? Well, the metal now allows us to really have some control of the spine and to realign the spine with some forces, to apply forces. It's a bit like having an internal brace, and the metal enables us to gain some control of the segments of the spine and be able to realign them. Some new technologies, so historically metal might involve screws and rods and fusion. Some new technologies, softer materials, polymers might enable us to actually have more of a cushion and restore motion. Motion preserving type procedures are a really exciting part of what's being developed for degenerative pathology and maybe for deformity in the future. So materials, biomaterials enable us to realign, enable us to reconstruct, and metal is only part of it. The spectrum of materials that we're using is really broad. It includes some really novel biomaterials that are more flexible.
Yeah. And I think that's the great take-home message, is that we are constantly striving to improve techniques, knowledge, education, and the equipment that we use to get patients a better result. And as Dr. Gupta said, there is not a better time to be having a treatment if you need it. Now, we're not recommending treatment if you don't need it, but if in the hands of your spinal expert, that's the best way to get the quality of your life back, and looking at the data that's been collected and analyzing and saying that you meet the parameters, then now is the best time to get it. Now, hopefully in the future we'll have even better technology and better knowledge, but if you need it today, you're an incredible opportunity to use the miracles of modern medicine to get yourself back to a better state. So, Sig, you've been involved in informing patients and educating patients. Can you talk a little bit about the work you've done?
Yeah, absolutely. I think information that we've discussed, information gathered through prospective collection of data, information through being really rigorous in our assessments of our practices and our assessments and learning from each other's experiences has been a terrific opportunity for us to really accelerate improvements across the field. And transferring that information is important both in terms of informing other physicians. So what I've learned from my peers on this panel is phenomenal and has really accelerated and continued my own education. And similarly, transferring that information to patients is really critical as well. So again, patients being informed about the decision for whether or not surgery is appropriate for them, for what type of treatment is appropriate for them, really empowers patients to participate in the process, and ultimately, I think, enables patients to embrace the process and after surgery, recognize that they've come to this point well-informed. The patients who are best informed are the patients who invariably have the best outcomes, where their expectations match their observed outcomes.
I think it's so wonderful to know that there's hope, that there's the ability to heal and come back, even with something as major as a major spinal deformity, scoliosis, severe kyphosis, these incredibly failed conditions that impair people's lives, and that we can find a way to get better. And so what the panel has shared today has been exciting and uplifting, and a big part about what we at the foundation do, which is to give people knowledge, to give people hope. So I'd like to close on some pearls, some words of wisdom, and we've got decades of experience. So Shay, why don't you start? Can you have any thoughts to the public about what you think is important or matters about any aspect of spinal health?
Yeah, sure. Ask questions. I think that if you decide to choose a doctor to be seen for your condition, ask him or her questions. I think do a little background research on your end. But I think that the big thing is to be informed. There is a lot of data and there's a lot of information out there. But I think your doctor, especially if he or she is well informed, can help guide you in that process. You can turn to the Scoliosis Research Society webpage in terms of baseline information, but then ask again your doctor what they believe the best care is, what their patient outcomes are, what they would do in this situation, what they would do for their loved one, because I think that then provides perspective then in terms of how this impacts you as a patient.
Excellent. Dr. Shaffrey?
Yeah, I think that the one thing, particularly for the larger the surgery that's proposed, the better you should feel about the relationship with the people that are treating you, because it's a long-term relationship. So for many of the studies we're doing that I'm involved in, we're following people out to 10 years. So we like to see them back. We like to monitor what's happening. And hopefully that the time that you've spent before surgery in the relationship has given you a good idea of what the course is going to be afterwards. And a lot of these surgeries, you have little bumps in the road. There may be, while you're in the hospital, there could be some small issue that comes up, or 3 months after surgery, an issue can come up. And the fact is that there should be comfort to realize that most people at 2, 3, 4, 5 years down the road are doing very well. And we had a study that showed that 94% of the people who had a major deformity surgery would have it again, all things considered, despite the bumps in the road. One of the things that we had some question about, and how research has helped us, a lot of people knew that people initially after these big surgeries that they were very successful. But several of us were involved in something called the Adult Symptomatic Scoliosis Study, which was funded by the NIH. And what's happening, we've now followed patients who have had major deformity surgeries. We're now at 7 years, and the results at 7 years are as good as what they were at 2 years. And almost nobody expected it to be that good and that durable. So what's happening is, I think it's important to have a good relationship with the person that is going to be operating on you. You want to feel very comfortable, and you want to have somebody that's going to guide you through some ups and downs over the first few months after surgery, and hopefully is going to be there as a resource for you in the future. And sometimes, for example, I might suggest a very small operation to take care of a little small problem that's part of a bigger problem. And that's something that we have that decision that we're going to do something, I say, is kind of hitting a single versus hitting a home run. Sometimes you can hit that single and the risks are very small and you're back, out living your life, a couple of weeks after surgery. And so that relationship allows you to do that, and realizing that if something more serious comes along, which it might, that you have that relationship established to do what needs to follow on next down the road.
Dr. Gupta?
Yeah, so I think the first thing I want to say is I want to be encouraging. Don't be discouraged just because you have a big spine problem. Knowledge is power. There's a lot of information on the web. There's a lot of experts in the field. It's globally accepted now, and there's a whole set of global experts. So seek experts. Don't be discouraged. Ask questions. And if you're not satisfied, ask for more experts. Don't just settle on one bad story or another bad story or one good story. These anecdotal things can really be discouraging. Do not be discouraged. Keep asking questions. And that happens quite frequently. Patients get discouraged locally. They don't seek the experts beyond local, what's available. So there's a lot of experts. There's a lot of great people in this field. Look towards major medical centers that have some of these experts that can handle some of these big problems usually. And so seek that out and seek help and ask a lot of questions, be inquisitive, and then I'm sure you'll end up in the right place.
Dr. Bervin?
Well, I'll build on that. I'll share on Munish's message of encouragement. Spinal disorders can be discouraging, and those who are affected by symptomatic spinal disorders have got significant disability associated with that. And to that end, rejoice in the fact that we're at, and we're really beyond now, an inflection point in medicine where we're now able to take together data, information, knowledge, and provide better care than we've ever been able to in the past. I also think that the management of spinal disorders remains with significant variability. So between providers, between regions, and to that end, I think it's important to recognize that there's a broad spectrum of providers, from non-operative specialists, physiatrists, pain management doctors, to operative specialists. And I think engaging people along that spectrum is worthwhile, especially if you're not comfortable with whichever decision might have been recommended. I think engaging others to get other opinions can be very useful.
Treating spinal deformity is probably the most complex area in spinal health care. And so it's not something to be taken lightly. So if you are having spinal surgery for a major deformity, make sure the person doing it is an expert in that field, that they're working in the major societies, being involved in data collection, and that they're current in the best techniques. And I think that that's the important thing. And all these gentlemen are such giants in the field. So I'd like to thank you and really appreciate you guys taking the time from your busy schedule at this meeting to help educate the public. Dr. Roy?
Yes, thank you. I'd like to echo that thanks. And please visit spinehealth.org to learn more information and get the tools and information you need to talk to your doctor about the best treatment choice for you. There is hope. You can get back to your life.